In the news this week, the NHS's Gender Identity Service for Children is rated inadequate by the Care Quality Commission. A study finds teens with mental health disorders are 3 times more likely to self-harm if they use cannabis. And a Nigerian Christian shares how she held firm to her faith in the face of intense persecution. Hello. NHS England's Gender Identity Development Service for Children has been given the lowest possible rating by the Care Quality Commission. The independent regulator graded GIDS inadequate after finding the safety of its services required improvement and staff were poorly led. The report detailed a series of worrying revelations, including poor record keeping and significant variations in the clinical approach of professionals. A senior CQC official said, "We were extremely clear that there were improvements needed in providing person-centred care, capacity and consent, safe care and treatment, and governance." Detransitioner Kira Bell recently won a legal case against GIDS at the High Court after she was given hormone blockers and cross-sex hormones as a teenager. Following the ruling, the NHS suspended new referrals for puberty blockers and cross-sex hormones for all under 16s. A US study has found that teenagers with mental health disorders are at significantly higher risk of self-harm if they smoke cannabis. Researchers found that young people with conditions such as bipolar disorder or depression who use cannabis are more than 3 times as likely to self-harm as those who don't. Cannabis smokers are also more than twice as likely to die of an unintended overdose and more than 3 times as likely to be murdered. Dr. Cynthia Fontanella said the findings should be considered as states contemplate legalising medical and recreational marijuana, both of which are associated with increased cannabis use disorder. The warning comes shortly after the UN narrowly voted to remove cannabis from its list of the most dangerous drugs. A senior Scottish Government advisor has said public bodies should ask questions on the basis of gender identity rather than sex when collecting official data. In new draft guidance, Chief Statistician Roger Halliday said questions on biological sex should not be asked except in specific medical situations, claiming it is likely to breach an individual's human privacy. Columnist Susan Dolgetty responded that the Scottish Government's determination to erase sex and replace it with gender identity could have serious consequences for women. If sex no longer matters when collecting data for public services, then the distinct needs of women and girls, rooted in our biology, can be ignored. And finally, a Nigerian Christian woman who was kidnapped by Boko Haram has shared how she and other captives refused to renounce their faith. Amina, whose husband was killed by the Islamist group 9 years ago, was injured when the terrorists opened fire on a bus she was travelling on in 2017 and then held captive for 8 months. She and other women were told to renounce their faith and embrace Islam, but they refused and continued secretly praying and singing to God, even when threatened with execution.
But we will say, to die is gain for us. We cannot denounce Christ. And thank God, all of us were ready, either it is date or release. And we say no.
Well, that's all for this week. For more information on all of our stories, plus much more, visit our website at christian.org.uk. Until next time, goodbye.